Hello, everyone, and how are we doing? I'm just gonna wait for us to come live. I'm gonna wait for everybody to join. This particular topic was brought about by Abdulaziz. So we're going to wait and see if he's going to join us before I start officially. So Abdulaziz asked this question that was yesterday on our live section, and I promised I was going to come around and talk about it in details because there are different causes. If you are watching this live session, kindly drop on the comment section your name and also where you are watching from. And today we're going to be talking about the causes of erectile dysfunction. Before I continue, my name is Mercy Mary. I am a registered nurse and also a registered midwife. So yesterday during our live section, somebody dropped this asked us to talk about the causes of erectile dysfunction, and I promised that I was going to talk about it today to the best of my knowledge. And if there is any question, people should ask on the comment section. So we have Thomas Andansi said, "Thank you for this post, United States." You're welcome, Andansi. How are you doing? So we have Mark Anthony. How are you doing today? I'm fine, Mark Anthony. How are you doing? Trust you're doing great. It's nice having you. So we have Terry from USA. Terry, how are you doing? It's nice having you. We have Niola from Nigeria, Djibouti. How are you doing, Nola? Trust you're doing great. Mark Anthony said, "Trust you're doing great and healthy." Yeah, I am doing great. I am healthy. I am fine. But I just had this opportunity to discuss this. I just wish Abdul Aziz will be online now because this particular live section was for him. So we have Travis. Travis, how are you doing? Trust you're doing great. So Thomas Addison said, "I'm doing well, ma. You're welcome." So I just wish Abdulaziz would join this live. We're going to give him a few seconds to join. Then I'm going to start. I'm going to go into details. What are the likely causes of erectile dysfunction? Like I earlier said, I'm going to repeat it again. Let me introduce myself for those that are just joining. My name is Mercy Mary. I'm a registered nurse and a midwife, and I have a master's degree in public health because I am interested in things. I'm interested in public health generally. Let's just keep it simple. And over time, I've been able to build a platform where I talk about reproductive health, I talk about sexual health. So if you have any question, anything that is bothering you, and you really want to talk about it, don't forget to drop on the comment section. So while waiting for Abdulaziz, I'm just going to give a summary of what erectile dysfunction is. There's likely going to be some amount of noise in the background because where I am is a little bit noisy. I'm not in the house, so it's a little bit noisy. So try as much as possible to get the information, and if there's any question, just ask. Okay, so we have Exodus. Hey, Minus, I last saw you last year. To see you in 2026. Happy New Year. My Exodus from Cape Town. Exodus, how are you doing? It's nice having you on our YouTube channel today. So if you are watching, just double tap on the screen as it automatically likes the live section. Double tap the screen and it's automatically like the live session. So let's go into details of what we are talking about today, and that is erectile dysfunction. So when we hear erectile dysfunction, in simple terms, it simply means that a man is unable to hold his erection. I believe as a man, you know what erection is. So the man is unable to hold it, is unable to even start it. Some they are able to start it, but they are unable to keep it for a longer period of time. Why some they are not even able to hold the erection at all. So erectile dysfunction is something that can make a man that can affect a man's self-esteem. It can affect his confidence. It can make him stressed out. For those that are experiencing it, you will agree with me that sometimes you feel less of yourself. You feel you're not able to meet up with your partner's requirements, and that makes you feel sad. So yesterday, while Abdulaziz asked that question, I told him that if you know the cause, once you know the cause, it's much easier for you to get the solution. But if you don't know the cause, it is difficult for you to get the solution. So the first and most important thing is finding the cause. The first and most important thing is finding the cause of erectile dysfunction. So that's what we're going to be talking about today. Finding what is actually causing it, because once you know the cause, you're able to know how to deal with it. Right, so the first cause I have here is heart disease. So for those that are having erectile dysfunction, ask yourself, do you have any history of heart disease, any issues with your heart? Have you ever had heart failure? Have you ever had cardiac arrest? So heart disease is one of the physical causes of erectile dysfunction. So I'm going to be listing a lot of causes today. All you have to do is to take notes and look at the one that looks similar to you. So in this video, it's more or less like an educational video. But if you are battling with erectile dysfunction, make sure you speak with your doctor. All right? If you are battling with erectile dysfunction, kindly make sure you speak with a doctor. So one of the causes I said I wanted to list is heart disease. So if you've ever had history of heart disease, like heart failure, cardiac arrest, things like that, it is something you should look into. Then another is clogged blood vessels. As a man, for erection to take place, like blood needs to flow heavily to the penis. So if the blood vessels are blocked, if something is blocking the blood vessels, for example, atherosclerosis, blood is not going to flow effectively well to the penis. So clogged blood vessels are one of the causes of erectile dysfunction that you need to take note of. Then the third cause of erectile dysfunction I would like to share with you is high cholesterol. Yeah, high cholesterol. Having high cholesterol is one of the causes of erectile dysfunction. High cholesterol. You see people talking about cholesterol. Cholesterol can affect your performance as a man. So if you know you are taking food that increase your cholesterol, it is very important for you to cut on those diets because high cholesterol can affect your erection. Then another cause I have to share, I'm going to be listing them, but any points that is not clear, kindly let me know. All right, I'm going to be listing them so that it's quick. So another cause of erectile dysfunction is high blood pressure. High blood pressure. So if you are having hypertension, you are on some antihypertensive medications, you're having high blood pressure, that can actually affect your performance as a man. So high blood pressure can cause erectile dysfunction. So if you are having high blood pressure, asking the doctor for some medications, taking your medications can help with it. So because if you know, okay, you're having high blood pressure and you're having erectile dysfunction, so treating the high blood pressure is going to go a long way to make it better. So don't just stay away from your antihypertensive medications. You have to take your antihypertensive medications regularly. And if you have hypertension, it is very important for you to work on your diet, work on what you are taking in, work on the food you are taking in. Right? So because high blood pressure is a cause of what? Erectile dysfunction. Hello Top Notch, how are you doing? Trust you're doing great. Let us know where you are watching from on the comment section. Then another cause of erectile dysfunction is diabetes. You see, I have noticed that some conditions, when you measure hypertension, diabetes comes hand in hand. So diabetes is also another likely cause of erectile dysfunction. So if you have diabetes and you are not taking your medications and you are not managing that diabetes, that can affect your performance. That can cause that erectile dysfunction you are battling with. So if you are having diabetes, you are having hypertension, it is very important for you to see the doctor so that they are able to manage the medical condition and help you out with erectile dysfunction. I don't know if I'm making sense. So if you are following, kindly drop on the comment section. So I'm going to go over the causes, okay, that we've listed. We've listed heart disease, we've listed clogged blood vessel, high cholesterol, high blood pressure, and diabetes as a cause of erectile dysfunction. Then another cause of erectile dysfunction is obesity. Yes, generally obesity and overweight has an overall impact on our health. When one is overweight, when one is obese, it has impact on our overall health. So if you are obese, if you are overweight, you are obese, the best thing to do is to try and see how you can work on your weight, because that has an impact on your performance as a man. So working on your weight is going to go a long way to help, because obesity has impact. So if you look at yourself and you find out that you are overweight and you're having issues with erectile dysfunction, that may be passing a message to you that obesity is the reason why you are passing through that erectile dysfunction. And one of the ways to actually help with it is to lose weight. Maybe start a gym class, work on your diet, the food you eat. That is going to go a long way to help. Then another cause of erectile dysfunction is metabolic syndromes. Metabolic activities has a lot to also play. Parkinson's disease, for those that have Parkinson's disease, if you have Parkinson's disease, that can affect your performance as a man. Parkinson's disease can affect your performance as a man. Then another is certain prescription. The medications you are taking. Are you on any medications? Okay, Top Note said she's watching from Abuja. So are you on any medications? What medications are you on? So there are some medications we take, we don't know the side effects. Generally, what I advise people is that whatsoever medications you are going to take, always try to find out the side effect of that medication. Because when you find out the side effect of that medication, it gives you like an idea of what to expect. So sometimes you are just on medication without knowing the side effects on your sexual performance. Okay, so certain medications you take has an impact on your sexual performance. Then overuse of alcohol and use of drugs. I've heard people saying that, oh, when they drink, when they take alcohol, it increases their performance, it makes them more active. The fact is, overuse of alcohol, overuse of all these hard drugs actually affect your performance as a man without you knowing. So if you're an alcoholic, you drink a lot, you drink excessively, and you're battling with erectile dysfunction, it is very important for you to work on cutting down the numbers of bottles you're taking or stopping alcohol if you really want to boost your performance as a man. So that's just the reality. And then if you've ever had surgeries before, you ever had surgeries that affected your spine, if you ever had spinal surgery, you've ever had pelvic surgeries, that can affect your performance. And one that can also affect your performance, which I believe most men are aware of, is actually low levels of the hormone known as testosterone. We all know that testosterone is a male hormone. So when there is a low amount of that male hormone in your body as a man, that can affect your performance. That can cause erectile dysfunction. So when people say hormonal imbalance, people usually when people hear hormonal imbalance, the next thing that comes to mind is that it's the women that are battling with hormonal imbalance. No, men also have hormonal imbalance. There are some men that have low testosterone. So if you're having low testosterone as a man, that can affect your performance. That can cause erectile dysfunction. That can make you not able to sustain an erection. Okay, so these are the various physical causes of erectile dysfunction. So please, if you're following, kindly drop on the comment section and let me know you're following and let me know you're understanding what I am trying to explain on this live section. So I've been able to list the physical causes of erectile dysfunction. So for me to know that you're following and you are getting value for this live section, double tap on the screen as it automatically likes the video, and also drop in the comment section and let us know where you are watching us from. So while that is ongoing, I'm going to talk about the meta causes the meta causes of erectile dysfunction. What can actually cause, like the meta causes or the psychological causes, I usually call it, of erectile dysfunction, and that is depression. If a man is passing through depression, that can affect his performance. That can affect his performance. Depression can affect performance. Anxiety, being anxious, can affect your performance as a man. Being depressed can affect your performance as a man. Stress, if you are stressed out, financial stress, emotional stress, that can affect your performance as a man. You're having issues with your partner, you are not in good terms with your partner, you're always quarreling, there's always fight, there's always misunderstanding with your partner, that can affect your performance as a man. Alright, so these are the meta causes. So when we talk about the physical cause, the meta causes of erectile dysfunctions are not left out. So that's something. Are you having issues with your partner? Are you having are you always arguing? Do you not see your partner as a terror? Do you not see your partner as an issue? Alright, that can affect your performance as a man. That can cause erectile dysfunction for you. So I've listed a lot of causes. I've listed several causes. What I advise you to do now is to look at these various causes I have listed and see which one applies directly to you. So when you get the one that directly appeals to you, that is going to tell you which solution is going to work for you. That's going to give you an idea of which solution is going to work for you. All right. So these are the various courses I have to share with you. If you have any question, kindly drop on the comment section. So let's keep the questions coming now. I've given a summary of the various causes of erectile dysfunction. So I'm going to go over it again for those that are just joining. Welcome to Nurses Lecture Room's live section. My name is Mercy Mary. I'm a registered nurse midwife in Nigeria, but in the UK, I'm practicing as a registered nurse in the theatre. I work in the theatre as an anesthetics and recovery practitioner. So on today's live, we're talking about the causes of erectile dysfunction. So we've listed various causes of erectile dysfunction, and I said some of the causes of erectile dysfunction are heart disease, clogged blood vessels, like a summary now, I'm giving a summary: high cholesterol, high blood pressure, diabetes, obesity, metabolic symptoms or syndrome, Parkinson's disease, certain prescriptions like the medications you're taking, overuse of alcohols and drugs. Okay, treatment for prostate. So if you're having prostate issues, or you're having a enlarged prostate, prostatitis, prostate cancer, and you are treating it, that can actually cause that performance issues. Then if you've ever had surgeries in your pelvic region before, that can cause that issues. Then we talked about low levels of testosterone. That low levels of testosterone can cause erectile dysfunction. Then in terms of the mental aspect, we talk about depression, anxiety, stress, and issues with your partner can actually cause that. So if you have any questions in regards to erectile dysfunction, kindly drop on the comment section. So Mark Anthony said, thank you for your lectures and do a great day. Thank you very much, Mark Anthony. So if you have any questions, kindly drop on the comment section. I think I have about 20 more minutes to spend on this live section. If you have any question, kindly drop on the comment section. We've given a summary of the various causes. I actually wish Abdulaziz was here, because he was the one that actually popped this question, and I know when he sees the video, he's going to watch the replay of it to see how it goes. He was the one that asked this question. So Therese said, husband had heart problem, diabetes, and high blood pressure. Men on here, pay attention. No sex for 30 years, and he had a massive heart attack and hit the floor dead. You can see now Therese is giving all men advice. This is someone said is giving all men advice from her own personal experience. She's advising the men out there. She said her husband had heart problems, diabetes, and high blood pressure. And I believe with all these problems that he had, it's going to be difficult for him to have sex. You can see no sex for 30 years with such heart problems. All these things, sometimes we think they are just little, they are not little. Okay, so heart disease, diabetes, and high blood pressure can cause erectile dysfunction, and it can cause no sex in a marriage, leaving the woman unsatisfied. So if you are a man and you are battling with these health issues, please and please pay attention to your health. See the doctor, get adequate help. All right, if you are a man and you are battling with these conditions, work on your diet. I usually say when you are sick, sometimes outside taking your medications, your diet plays a key role when it comes to your health. Now he is dead. Okay, this is somebody giving advice from her own experience. Thank you very much, Therese. I really appreciate you for dropping that comment, and I don't know how to. Is it how are you doing? How are you doing now? Do you have kids? What are you up to now? I know it's a long. What should I don't really know the words to say, but I just pray you heal and get stronger by the day. That's my prayer for you, Therese. You get, for those that are just joining, you can read the last comments in the comment section. All these things affect a man's performance. No sex for 30 years is a long yes, and well done, Therese. It's a long yes. And sincerely, in such situation, when the man is married to a woman that likes sex, it's going to be difficult to stay with no sex for 30 years. That can lead to marital issues. That can lead to marital crisis. That can lead to spouses cheating. So that is why, as a man, you need to prioritize your health. You need to prioritize your health. You need to take charge of your health. Okay, it's not just the women that should take care of their health. Men also. I think most men are not taking care of their health, and I feel sometimes some men, they work so hard and they forget their own self. They forget that their health is also a priority. Go for checkup once in a year, even if you are not sick, you are not having temperature, you are not coughing, you are not having heart failure. Just go for once in a year checkup, do a blood test, know what is happening, check your blood pressure, check your sugar once in a year. Just do that to keep track of your health as a man, because when all these things start hitting hard, it's going to affect your sexual performance. And I believe as a man, when your sexual performance is affected, your self-esteem is also affected. You don't even have a voice sometimes. Okay, you don't even have a voice sometimes as a man when your sexual performance is affected, when you are battling with erectile dysfunction. So that is why it's very important for you to like check on yourself. You don't need to like fall sick. You don't need to be critically ill on bed before you do a checkup. Always go for a checkup. Take blood samples. Go, let them take a blood sample. Let them do a blood test. All right? Because that's where you get a situation of people sleeping and not waking up. People just sleep and the next morning they are gone. That's why you see a situation that, oh, we were laughing today. That's a situation, we were laughing today, we were talking today, and the next morning he just fell down and slumped and died. Terence is saying, listen to your doctor, including about diet. Diet is very important. Especially, I keep telling people, these days we have a lot of processed food here and there. We have a lot of canned food here and there. We have a lot of fatty food here and there. Okay? We have a lot of it. And we focus more on this processed food. Focus on your diet. I think the best investment you can do to yourself is not real estate. That's what I am saying to you. The best investment you can do to yourself is not having a big mansion. The best investment you can do for yourself is your diet. The best investment you can give to yourself is watching your diet, what you eat, what you take in. So I think I said this. Capriva says, like you're talking to me about me. I'm only 35. I'm not confident about my sexual life anymore. You can say, so work on your diet. You can get your life back. You can get your sexual health back. Work on your diet. If you are having any medical condition, treat it. See the doctor. Get help. Sometimes we work so hard. We work on investing in a lot of things. We want to invest in real estate. We want to invest in this. We want to invest, I don't know what to say. We want to invest in stock and shares. We want to do crypto. We want to do this. But the major investment we are failing. And that is investing in our health. See, health is not just sexual health, is part of health. So investing in your sexual health is very important. Investing in your overall health, it's very important. Don't just walk all your life and forget yourself. I've seen situations of people slumped, died instantly. You can see what Terence said. Terence said he slumped and like he hit the floor and died. Please work on your health. Work on what you are taking. That's the best investment you can ever give to yourself. That is the best. Sleep. Get good sleep. Get good sleep. Sleep a lot. Get that 8-hour sleep. Sometimes like I usually tell people at work, like I don't joke with my sleep. No matter how hard I work, no matter how hard I try to be out there, you see my sleep, I don't joke with it. And my kids already know. Like I have 2 kids. I've already sleep trained them. 7:30 they're on bed. Break or bed, they're on bed. In such a way that 6:30, 7 o'clock they are already awake. They are able to get at least 11 to 12 hours sleep. Okay, so these are the things we should take into consideration. These are the things we take into consideration. You see, sleep. In my house, my husband, he sleeps, I sleep, my kids sleep, everybody. As far as you're in my house, sleep is very important. Yes, we're going to make the money. Yes, we're going to be rich. Yes, we need, but you see your health. Prioritize it. This is a new year. Prioritize your health. I'm talking to the men in particular because I don't know if the men are stubborn when it comes to their health. They neglect their health a lot. Most men, they're just so focused on working, and they forget their own health. So this is me talking to the men. Women, even women say these days, they forget their own health, they forget their full body. Let's prioritize our health. This is a new year. Prioritize your health, prioritize your sexual health. Yes, I'm not talking about it. Prioritize your sexual health. It's very important. It is very important. Watch your diet. You see food, watch it. Spend a lot on fruits. Spend a lot on vegetables. Leave those processed food alone if you can. So sometimes I know it's your time schedule, the time frame, busy. Like I understand, but try and cut down. Even if you cannot do away totally with processed food, cut down on this processed food. Focus more on healthy food. Drink water. So I think my own weakness is drinking water. My personal weakness is drinking water. So what I do is that I have water in every angles of my house. So that's what I'm trying to do to help me build that. Having water in every, like in my bedroom, close to my window, there is water. Like I try to have water available. My weakness is drinking water. You see, diet, water, and sleep. That goes a long way to help. Trust me. Diet, water, and sleep. Diet, water, and sleep goes a long way to help. So somebody is asking, Exodus said, what disease or problems comes from having fibroid? Fibroid, I know fibroid comes with a lot of pain and infertility issues. People with fibroid can face some infertility issues. That doesn't mean people with fibroid cannot give birth, but people with fibroid, they are at risk of facing fertility issues because depending on where the fibroid is located, that can affect the growth of a baby. So that's what I can remember now about the problem that comes from fibroids. Fertility issues, then severe pain. They usually, depending on the fibroid, the size of the fibroid and the location of the fibroid, it can also cause that severe pain and discomfort for the woman. Why some people, they have this fibroid, they don't even know they have it. Some people have this fibroid, they don't even know they have it. So everybody has different bases when it comes to fibroid. So if you've been watching, all you have to do is to double tap the screen and it automatically likes the video. Double tap the screen and it automatically likes the video. If you have any question, drop on the comment section. So Exodus, is your question answered now? Exodus, let me know in the comment section if your question is answered. And if you've been watching, double tap the screen and it automatically likes the video. If you have any question, put it on the comment section. I have up to 10 minutes to spend. Before I go away. So I think we are done for the topic. We've talked in details. I kind of overemphasized the importance of your diet. I kind of emphasized the importance of looking after your own health. These are key priorities. These are things you should take note of as a man and as a woman. This is like generally. Read through the comment section. You can also learn from the comment section of this live video because somebody dropped something that I really want everybody to learn. She said, listen to your doctor, including about health. And she also gave a personal experience. Read it in the comment section and you're going to get what this person is saying. Okay, so if you're watching, you have any question, I have up to 10 minutes to spend taking your questions. We are done for today. Tomorrow we are going to be on by this same time. I'm going to look for a particular topic to talk about. And if this is the first time of coming across this channel, you've not subscribed, I will advise you to subscribe because we have a lot in stock for you. It's an open space where you can ask your questions. This is not a space for perfection. This is not a space where we expect people to be perfect. This is a space where people come out and ask their questions, they bring their vulnerability, and we help out. But if you are a man battling with erectile dysfunction, my advice for you is to see the doctor. Okay, go and get your head checked up. All right, you deserve that rest. As a man, you deserve to rest. Go get your health checked. Find out what's the problem and get it sorted. Okay? Go get your health checked. Go get your health checked. You need to live to see your investment grows. You need to live to see your children grow. Go get your health sorted. Tomorrow I'm going to be talking about mother's guilt. I think this particular video is going to be more of the women. I think the men should also join, because I believe the men have wives, and this is a video that should like help them understand the wives. So I'm going to be talking about mother's guilt, personally how I experienced mother guilt and how I was able to deal with it, how I was able to like avoid me being perfect. I don't want to be perfect. In my previous live yesterday, I talked about someone asking me about my goals for 2026. And I said I just had one goal, and that goal is to be thankful, to be happy, and to be grateful. So that's the only goal I have: to be thankful, to be happy, and to be grateful. I don't want any other goals. Everybody has goals, I know. Maybe next year I will have some strategized goal, but this year is just Thanksgiving. This year I just want to be thankful. All right? So we are done. If you have any question, you have the next 10 minutes to ask before the live ends. This is not a space of perfection, like I earlier said. So tomorrow we're going to be talking about mother's guilt. Mother's guilt. So that's something we're going to be talking about tomorrow. So feel free to join the live section tomorrow. So I have like how many minutes? 10 minutes more. Then the live is going to end. The live will be ending in 10 minutes. Do we have any question? If you were watching and you've not double tapped on the screen to like the video, kindly double tap on the screen as it automatically likes the video. Double tap the screen as it automatically likes the video. Do we have any questions? We have 9 minutes to go and the live is going to be ending. For those that missed the beginning of the live, what I would advise you to do is to play the live sections when the live ends. So when I end the live, all you have to do is to go back and replay. You're going to be getting all the details. I'm going to be posting it. I'm saving the live so I don't delete the live sections. So you're going to be getting every bit of the live video at the end of the live sections. Okay? It doesn't have to be perfect. So we have Love Terrace. Love Terrace said, "You spoke the truth today. Love you and your family." Thank you very much, Terrace. Terrace, how long have you been following us? Did you just come across the YouTube channel, or you've been following us for a very long period of time? If this is the first time, don't forget to subscribe and don't forget to double tap and it automatically like the screen. Okay, for those that missed out, you can see Terrace said that we spoke the truth today and it was interesting. So what I would advise you to do at the end of the live section, go back, play the video and get all the information that you need from this live section. Trust me, it's really beneficial. As a man, as a woman, like I like it when couples learn about each other. What do I mean by that? I like it when a man learns a particular topic because of his wife. And I like it when a woman learns a particular topic because of her husband. It shows love, it shows intentionality. Okay, it shows love, it shows what? Intentionality about each other. So couples, when you say a particular topic, it's not talking about a woman, but it's talking about a man. Learn on behalf of your partner. Learn to help your partner. Learn to help them. That shows you're intentional about their growth. That shows you're intentional about their health. That shows you're intentional about their well-being. Okay? Learn for each other. Learn to help each other grow. Learn to help each other. So we have, and Teresa said, "I have been subscribed for a while. I get notification for your post." That's good. Well done, Teresa. That's really great. It's nice having you. It's nice having you in our space. So tomorrow, same time, we're going to be here and I'm going to be talking about mother's guilt. That's what I'm going to be talking about tomorrow, mother's guilt. Because I think I don't really feel guilty anymore. With my first child, I think I was feeling a lot of guilt. And when you're feeling a lot of guilt as a mother, you end up just being miserable at the end of the day. You end up not being productive. You end up not being there for them because you keep blaming yourself for everything. They have a cough, I blame myself. They have vomiting, I blame myself. They do this, I blame myself. So I was always blaming myself. So I want to talk about that. So if you are a mother, don't forget to join us tomorrow. Today we talked about the men. So tomorrow's topic is for the women. So the men can also join, and if they have any question, they can also ask. All right. So tomorrow we try as much as possible to make it interesting. We try as much as possible to give facts rather than fictions, because I'm going to be sharing from my own personal experience as a mother how guilt almost made me less productive. So I'm going to be sharing that. Okay. So we have like 5 minutes more. If you have any question on the comment section, if you enjoyed today's live, drop on the comment section. And if you're just watching, all you need to do is to double tap the screen and it automatically likes the video. It's so painful that Abdulaziz could not join us. I feel really bad because this particular video was for him. Yeah, I promised him I was going to come live to talk about it. So that's why it's paining me that he was unable to join the live section. Abdulaziz, wherever you are, when you get this notification, join the live. Like, seriously, I really wish you were here, but I don't really know why you're not here today. So whenever you get the notification or whenever you see the live video afterwards, don't forget to rewatch it. Okay? I wish you were actually in this live section, because yesterday I told you same time. I don't know why. I told you I was going to be here same time yesterday and I was going to answer your question in details, which I've done, and you're not here. So I think you owe me, Abdulaziz. If I was seeing this live section, I think you owe me for making me come here to talk about your topic and you're not here and you're not present. I think you owe me. You owe me big time, Abdulaziz. You owe me big time. You owe me big time, Abdulaziz. You owe me big time. So we have like 3 minutes more, then the live section is going to end. 3 minutes and our life is going to end. So I need to work on tomorrow what we're going to be talking about. I've already said I just got the mind to talk about Mother's Day tomorrow. Lift up the middle finger in between. Because you're like growing up, like you stab yourself like So we have 2 minutes more and the light is going to end. Just go underneath to the tube, roll the artery against the bone, and then you go The live section is ending in 2 minutes. Okay. For those that joined late, I'm sorry you joined late. I'm sorry you didn't join us on time. So all you need to do is to go back and rewatch the play. Exodus is saying, I don't sleep. I don't know why. Sleep is very important. Do you have a lot of things? Sometimes when you go to bed, that's when unnecessary thoughts kind of close down our mind. That's when we start thinking of goals that we need to achieve. That's when we start thinking of what we've not done, what we've done. I think working on the mind, one thing that can help, I think I've made a video on how to help you sleep at night. So the first thing is put a schedule to always go to bed by that time. When you've put that schedule, your phone should be away from you, far away. Don't touch the phone, because sometimes the light rays from the phone actually are the reasons why we're not sleeping. So take your phone as far as possible away from you. Off the lights. Think. Go through your thoughts. If you are thinking, just think about sleep. Just think about, if other thoughts are coming, try to suppress it and think about sleep. So the more you think about sleep, the more you focus on sleep, how sleep look like, how your dreams are going to look like, the better for you. All right. So focus on sleep. You see phones. I think phone is one of the major reasons most people don't get enough sleep. So stay away from your phone. Focus on the sleep. Think about sleep in the dark. Think about how it's going to look like. And at the end, I believe it's going to go a long way to help. All right. Like I earlier said, life is ending now. I just want to use this opportunity, though everybody has gone, though everybody is out. I just want to use this opportunity to thank everyone for joining the live section. Hopefully, we're going to see you tomorrow by the same time. And we're going to be talking about mother's guilt. All right. See you tomorrow. And thank you all for joining. Exodus, let me know if that helps.